noted, experts are still working to determine whether Omicron is more contagious than the Delta variant. So joining us now to talk a little bit more about this is virologist Dr. Andy Pekosz with Johns Hopkins Bloomberg School of Public Health. I'm so glad you are here because I think every time we hear of a new variant, we sort of automatically think the worst. But variants sort of pop up and sometimes they just fade away and they don't pose a threat to us. But the WHO has dubbed Omicron as a variant of concern. That's the phrase they use. Can you expand a little more about just what this means and what we know about this variant so far?
Well, what's important about a variant of concern is that it's a variant that has shown one of three things: either increased ability to spread in the population, increased disease, or the ability to evade vaccine-induced immune responses. And with Omicron, on paper, we see mutations that could mediate all three of those things. So on paper, this looks like a variant that is of high concern, and that's one of the reasons why WHO acted like it did. What we're really waiting for right now is the epidemiological data, the data from the population, to get a sense of how quickly it's spreading and what the disease looks like after infection. And then finally, if people who have previously been infected or vaccinated are getting infected with this variant at a higher rate.
So, when we were talking about the emergence of a vaccine, there was a lot of talk about what we need to do is get as many people vaccinated as possible, and that way we would reduce the emergence of new variants. But if, a part of the population was vaccinated, then that could be almost riskier. But this is your area of expertise. So can you talk to us about how vaccination rates do or do not impact how variants emerge and spread?
Yeah, I mean, what you said is absolutely correct. Viruses aren't smart. They just incorporate mutations in their genome randomly. And every once in a while, one of those mutations, two of those mutations, gives the virus an advantage and allows it to spread more effectively in the population. So by lowering the total amount of infections that are occurring, you reduce the chance that a variant can emerge. And that gives us longer protection from our current vaccines. It reduces case numbers, it reduces severe disease. So getting case numbers down at the beginning of the pandemic was a goal. It continues to be a goal. The thing is, we now have the tools such as vaccines to be able to do that. We just have to do that more effectively and with a more global perspective.
And is there a greater chance of new variants popping up that could be more dangerous to us when you have only a partially vaccinated population? Or is that just kind of, because I think we have this idea kind of like bacteria and antibiotics that, if you don't use antibiotics properly, then you get a more virulent bacteria. But that's not really the case with a virus, I think. But could you clarify that?
Absolutely. You don't need 100% vaccination. What you need is a high level of vaccination that stops the transmission of the virus among people. And until you get to that high level, you are in a situation where there's enough people who have no immunity who can get infected, and then viruses coming from those infected individuals can enter vaccinated people and unvaccinated people. And that sets up a process that we call selection, which may lead to the emergence of other variants as well. So the goal is really to get as many people immunized as possible so you can reduce that transmission and the case numbers significantly as fast as possible.
So now we're back to this debate about travel bans and whether or not you can keep a virus, from crossing the border. We're seeing travel bans pop up across the globe. Could a policy of controlling borders to avoid internal lockdowns be an actual viable solution against this variant?
Well, I guess there's two things to think about here. One is, on paper, travel bans look like they should work really well, but practically speaking, they never work as well as people think they should. Oftentimes they're put in place too late. We're seeing that already with the number of cases of Omicron that are occurring outside of Southern Africa. But more importantly, that has to be one piece of a layered approach to limit the spread of this variant. And you have to follow things like travel restrictions up with increased testing, increased sequencing of viruses, identifying people who have traveled to areas of risk and monitoring them more carefully, because it's those combinations of things that will help us prevent or slow the emergence of Omicron here in the US and in other countries that don't already have it spreading within the community.
So as you know, we are now moving into sort of a season of mass movements within this country and outside of the country with the holiday season. A lot of people traveled for Thanksgiving gatherings. They're coming back. They're going to travel again over, the next few weeks for the holidays. I know at least with one event that I went to, the host asked that we all get rapid tests before we arrive. But I was at another event and no one asked that at all. So I guess I got to ask you your advice. What steps should be taken post-Thanksgiving before we head into the rest of the holiday season to keep us safe and to keep those around us safe? Should we be getting tested upon returning from seeing friends and family?
Well, it's important to note that even if you don't consider Omicron, many parts of the US are seeing a surge in COVID-19 cases due to the Delta variant that has been such a scourge on this country from the summer and continues to be so. So I think you don't have to think about Omicron to be careful about COVID-19 infections. If you've traveled, if you've been in large groups, if you're not sure the people that you've been in contact with, now is the time to really be careful, monitor yourself for symptoms. If you get a scratchy throat, if you get some small symptoms, don't just blow it off and say, all right, I'll power through this. Go out and get a test and see if it's going to come up COVID-19 positive. The other thing is, we're coming into respiratory virus season, and there's data from across the US and the Northern Hemisphere that things like influenza are increasing as well. So you may get sick and get a COVID-19 negative test, but that still may mean you're sick with something, and it could be influenza. And while influenza isn't as dangerous as COVID-19, it certainly is a dangerous pathogen for many parts of the population. So pay attention to your symptoms. Don't be afraid to go out and get tested. And if you haven't gotten boosted, get your booster. If you haven't gotten vaccinated, get vaccinated.
Dr. Andy Pekosz, great advice. Thank you so much.